for attending today's session, Addressing Service Gaps in California for Youth in Foster Care. A quick moment for housekeeping items. I have muted everyone by default, so we won't be disrupted by latecomers. But when you want to talk during the open discussion portion of When Asked by Speaker, just click the microphone icon in the bottom bar to mute or unmute yourself. Please have your camera on during the session to meet STC requirements. Please mute your microphone when you're not speaking. And actually this session, we will only be using the chat feature. You're welcome to talk through the chat box and ask questions. After each segment, there will be a section for questions that can be answered through the chat box. Okay, I would like to go ahead and kick it off to Dr. Adolfo Gonzalez, Chief Probation Officer of Los Angeles County Probation Department.
Thank you, and good afternoon, everyone. Thank you for joining us. I am Dr. Adolfo Gonzalez, Chief Probation Officer for the County of Los Angeles. Thank you for joining us today for this session entitled Addressing Service Gaps in California for Youth in Foster Care. As you may recall, this past December, county probation departments throughout the state and child welfare departments were notified that out-of-state group homes were being decertified, which meant we had to scramble to figure out what to do next. At the time, California Department of Social Services provided 45-day notice to facilities about a decertification based on the state findings of them violating certain California laws and regulations as it pertains to the safety and the well-being of the youth. As a result, approximately 25 counties had to quickly make sure that the youth who were placed out of state returned safely to California by the beginning of the year. Huge undertaking. While also factoring in the COVID guidelines, as you recall, it was during when COVID had just hit and we were going through this worldwide pandemic. This was a huge task, but through it all, we were able to accomplish the youth returning home safely through a collaborative effort from county, state, and certain organizations that provided the services to assist our youth. I can tell you personally, we had 4 youth that we had to bring back. 2 were released home, 2 had to be placed in juvenile hall since we had nowhere to put them. As it turns out, one of the youth was positive for COVID, and we managed through that during the pandemic. This session here will cover some of the key findings of what youth were originally placed out of state and some lessons learned during the process of transitioning the youth back to California. Additionally, you will learn more about what is currently being done to help address the service gaps that we see here in California. With that being said, I am pleased to introduce our presenters for this afternoon session. I'll start off first with Kevin O'Connell, Research Analyst, Chief Probation Officer of California, followed by Leticia Galyean, Chief Operating Officer, Seneca Family of Agencies. Then with Christine Stoner-Mertz, Chief Executive Officer, California Alliance for Children and Family Services and Catalyst Center, along with Alex Volpe, Project Manager for Catalyst Center. And with that, let me introduce Kevin, who will take it from here. Kevin?
All right, thank you, Chief. Let me share my screen here. All right, well, thank you everybody for joining me today. As Chief Gonzalez mentioned, this has been a transformative year, 2020 and into 2021. And I think I've actually kind of at the, I guess, the forefront of a number of transformative years since CCR, Continuum Care Reform was enacted. And today I'm going to kind of go through one, I think a lot of the kind of ongoing changes and improvements that have been happening within probation as well as for probation youth, because youth and foster care make up a big part of like that of our system. But also there's been some bigger kind of like, I guess, system-wide declines in how juvenile arrest rates, juvenile kind of justice engagement rates. And so really like probation foster care population is part of a bigger trend that's going on of a lot of different things. And so as we start thinking about the gaps in services and the gaps we need to kind of gain to understand it, it's also important to kind of zoom out a little bit and just kind of take account for the last 10 years of really some monumental changes that have happened in the system. And I think as we're thinking about the youth with higher levels of needs, it's really important to kind of think about, you know, how does that fit into the bigger narrative of what's going on, where there's like far fewer youth in the juvenile justice system overall, as well as but a more concentrated set of complex needs. So how does the system kind of take that into account And how do we think about this going forward as we're trying to look at new ways and innovative ways to partner with providers? And as my colleagues will be speaking about a little bit after me, how do we really think about what's next? Because COVID-19, as well as the impacts, were complex, they were large, and I think as we all know, we're all still trying to come out of that both personally as well as youth we're trying to serve. So I think how do we kind of figure out what comes next? And I think sometimes the most useful way to think about that is to think about, what's happened in the past a little bit. And I think in my role in this presentation, it's really to kind of set the stage. What do the data say from the last couple of years of youth being placed out of state? And then as we kind of enter as Chief Gonzalez mentioned, a very quick turnaround to move a lot of youth back home. What are some of the indicated needs from some of the youth that were being placed out of state previously? Because that'll help give us an indication of the kind of capacity we need in the state, as well as some of the things we want to make sure that happen regionally as well as across the state. Because as you all know, 58 counties have a wide variety of needs. And I think as we're looking at the state, that's just one lens to look at it. Really, it's going to be a regional effort as well, because every county has a different set of needs. And how do we make sure that those things are available to the youth there, but also think regionally as well as the things around the state. And I think as we kind of think about this too, I think there's also ways to kind of think about how do we add to the continuum of care upstream, not just the congregate care setting, but things like resource family and resource parents. How do we make sure there's enough parts of the system working overall? And also continue to add capacity and adapt STRTP capacity for the specialized needs of probation youth, as well as what are the best practices in the field for really changing behavior, both for mental health needs, but also from justice involvement. And I think as we kind of look at this, we're also going to say, what are the kind of specialized things that are actually out in other states that California maybe didn't have? What are the kind of things we'll have to kind of bring into the state to build capacity for? Because now we don't have that, again, the option out of state isn't there anymore. So how do we make sure we really understand what those needs were to then bring them back in state? And so what I'll be covering today is kind of two big areas fairly quickly here, then turn it over to folks who are kind of, I guess, really working on when the decertification happened, how did these youth get moved back over, back to California, but really some context of probation foster care. What does the system look like? What is the kind of the bigger lens I was talking about? And also, what are some of the characteristics of the out-of-state placements before decertification? Which to me is kind of an important indicator because I think even though we want to look at kind of the youth that got moved back in, COVID-19, I think, really had an impact on kind of just the general kind of system overall. So how to make sure we kind of understand a little bit of that history as well. So they'll be the two main sections I'll be hitting on. I think Stephanie had mentioned, we're new questions kind of after my short presentation. We'll do have room for questions in the chat. So if you kind of have things that come up, that pop up, that you have questions about, please put them in the chat and I'll be happy to answer them at the end of my session. So a little bit of context for everybody. Some folks probably know this, maybe it's new for other folks, but since 2007, about 14 years ago, there's 60% fewer youth are in the juvenile justice system overall. And that's a pretty staggering accomplishment if you think about it. And really, it comes from a number of different declines, both of youth on supervision or probation overall, but also big declines in youth being sent to the Department of Juvenile Justice, which is soon to be not anymore. Things like alternative custody, ranches and camps, things like juvenile halls. But also a really big decline in probation foster care, from about 6,000 youth on probation foster care in 2007 down to about 1,500. And so again, if you think about the scale of that decline, that's a really impressive accomplishment. And I think points to both the work that probation's done to find alternatives for youth, but also part of a bigger decline in juvenile arrest and juvenile crime overall. But again, our focus today is really on that probation foster care area. But I think you're kind of thinking about this, changes in the law, changes in practices, change in kind of how things have kind of gone in the state have really kind of changed how the system looks overall. So 1,400 youth down from, again, about 6,000 a couple of years ago. And I think then you should put this in context. One of the ways that we kind of think about this is that, juvenile halls are oftentimes where youth who are awaiting placement in a court, judges order them to be placed outside the home. It's something they have to wait to actually get placed in one of these facilities. And this is kind of that longer term time frame, but you're looking at it, about 300 youth were awaiting we're in juvenile hall awaiting placement as of about late 2016. And that was down to about 200 at the beginning of 2020 before COVID. And then as you're kind of seeing there, as a percentage, it dropped fairly quickly. In the mid part of 2020, the actual number of youth in juvenile hall awaiting placement was down around 50. So again, part of that is COVID because, I think departments are trying to make sure that youth were safe and that if they didn't have to be in juvenile hall, they're in other places, and also other types of ways to divert and avoid youth coming into the juvenile hall at all. But the idea here is you see the decline in probation youth awaiting placement decline faster as a percentage of total average daily population than the total youth overall. So you actually have about 10%, 2016, a portion of the juvenile hall waiting placement, down to about, I think it was a little under 6 by the beginning of 2020. And then that bottomed out about 4%. And then it's back to about 6% now as kind of the world starts opening up at the end of 2020 and early 2021. But the context there is oftentimes when there isn't enough capacity in the system to take youth, oftentimes you see youth waiting in juvenile hall. And so during CCR, luckily there has been really an improvement in the number of youth awaiting placement, and also the lengths of stay have gone down as well. And so those are all pointing to kind of the system is kind of working as we intend to start to move youth into the next placement as quickly as possible when they have to, make sure they aren't spending more time than needed in a juvenile hall or a unlocked facility. Then the kind of last kind of piece of context here, overall, we've had about, there's only about 30% of probation youth are in foster care are in congregate care. And that's actually a big decline proportionally to 2016 when CCR largely went into effect, because you're actually down from nearly 50% were in congregate care then. So actually it's a really large scale improvement in just the number of youth overall. This is kind of a COVID effect as well, but it's kind of important to realize that there's almost 1,000 fewer kids in congregate care over the last 4 or 5 years. And some of that, again, could be kind of a COVID effect as well. But it's important to kind of think about this as a kind of a big kind of contextual change that the state is already overcome, is coming. And obviously there's other parts of CCR that are kind of ingrained in this as well. But I think as we're kind of looking at congregate care and the role it plays, again, this decline I think is pretty impressive. And it's also a way to think about those 600 that are left are also having more and more complex needs. And so I think that's often where some of the complexity lies, and it's kind of the nexus with out-of-state placements. And so kind of, again, a little bit longer term view of kind of where out-of-state placements were in California. In 2014, there were about 364 out-of-state placements. And by about the end of 2019, about 260, which means you have, even right there, about a 20 or 30% decline over those number of years. And then with decertification happening in the end of 2020, 56 youth were then moved back over. But again, you're already having a decline going on in the state. So this is already kind of happening, but the decertification definitely sped that up. And then with only 45 days to comply, you really then see all the partnerships and really kind of the effort that had to be taken by probation departments and providers to really move youth back safely and effectively back into the communities. And I think it's an important part to kind of think about, though, is that probationists are looking at opportunities and ways to best serve youth and get those placements. They're always going to look closest to home, but oftentimes the challenge is there really aren't the right kind of services close to home. And I think about a state as large as California, the distance between San Diego and Modoc County up north is probably just about halfway across the nation. So in some ways, we're still talking about the size of the state geographically is quite large. As you probably can imagine too, the services are oftentimes aren't all proportional to the size of the state. But it's important to kind of note that a lot of times those gaps include things like intensive mental health care services, access to resource parents and SCRT capacity for youth with complex needs, but also with public safety risk. Really trauma-informed responses that help meet some of the needs of these youth beyond just some of the therapeutic needs, but oftentimes some of the trauma needs. And also then specific resources for girls. Because what we kind of saw with a lot of the youth being placed out of state, girls oftentimes were a little bit more highly represented than you might think than based on the normal in-state population. But this is all to say, I think you're kind of looking at end of 2020, the decline was already kind of happening with out-of-state placements, but the decertification process sped that up. And I'm going to focus a little bit on 2019, only because I think it gives a little clearer perspective pre-COVID about what some of those needs are. And I think it's at least helpful to kind of understand what we're kind of looking at as we kind of grow and kind of try to improve and try and increase the amount of access for these specialty mental health needs and special needs of these youth. Around the state, this actually, the chart on the left there is really the proportions based on the county probation regions of the youth being placed out of state. 20% came from the Bay Area, about 9% from the Central Valley, 2% from the far north, 13% from Sacramento, about 55% from the southern region. And what that means, that translates into, is that there's some really specific needs across the state, but those aren't always proportional to the number of youth in state. And so I think what we're going to try and see is how many of those youth are coming back and really going to be ones that are going to be kind of watch extra capacity for each one of these regions. Because even if we're able to kind of look at the state and say we have enough capacity for certain kinds of service based on the whole state, those have to be regionally appropriate and regionally based. Because sometimes the gaps in services and the gaps in resources in one of these regions can then express itself as then, not really being able to place youth as quickly as possible, as quickly as might like. So again, there has to be kind of a regional attention paid to regional needs, as well as kind of the statewide needs overall. In terms of demographics, the youth actually being placed out of state tended to be older than the in-state placements, as you might expect, as you might kind of understand. More females than in-state placements, but a similar racial composition to in-state placements. So as we're kind of thinking about opportunities here, again, we need to kind of increase the capacity for youth girls, obviously, I think if they were kind of more represented out of state, but also think about how the youth, what are some of the barriers for getting youth placed that are older, because that tended to be one of the areas that was being sent out of state. So are there things to better kind of understand that population to make sure those needs can be met? And then as we're kind of looking at the indicated behaviors for probation foster youth sent out of state, placed out of state, really substance use pops up as almost in 71% of all the youth placed out of state. Substance use was a need presented or indicated as a behavior need. But also you see things like aggressive behavior, which is like kind of acts of violence could actually could be an area where you might actually have a youth being placed out of state because it's harder to place them in state. AWOL, which is absent without leave, where they're actually consistently running away or going AWOL from their placements. But also you have things like CSEC, which is commercial sexual exploitation of children, where a girl might have to be placed out of state to get farther and farther away from their abusers or from the people that are hurting them. So there's also times an issue where you kind of have these placement reasons, which are most also about the victimization as well as about the behavior. But the idea here is you have these needs being placed out of state. How do we replace those or add to them in California to make sure we have the capacity to meet these needs? Because with the out-of-state placement no longer an option, we have to kind of think about new ways to do that. And again, back to the size of California, if the need to place somebody out of state for CSEC or for things like gang involvement to give them more distance between their community that was kind of causing some of the behavior, there's going to be ways to do that in California where you go think north to south, or some of the other geographic ways you can kind of do that. But the idea is that how do we replace that capacity but still stay within the state boundaries of California? Last, and I think this is kind of a way to kind of frame some of the regional issues that I was kind of mentioning before. There really is kind of this plan with kind of gaps, plan for the service gaps with kind of regions in mind. So this is a chart of kind of four of the major needs that popped up in kind of our indicated needs. What we kind of see here is there are, substance use, again, very consistent, 60 to 70% of the youth in each one of these regions presented those as issues. But what are the kind of things we can think about doing this for things like mental health needs? I found it interesting that things like Sacramento had a fairly low rate in terms of what they indicated that being the reason for placement around mental health needs relative to the rest of the state. Also, you have higher rates for things like AWOLs for certain other regions as well. So the idea here is how do you kind of look at these kind of needs regionally and make sure you're planning with a region in mind, because each one of these regions has its own set of needs, geography, challenges, and how do we make sure we are kind of planning these kind of needs and addressing them within the context of the regions they're in. Because at the end of the day, the providers are going to be local, the families are local, the kids are local, probation departments are local. How do we kind of make sure that the facilities and the access is there? And as we kind of transition to the other speakers, I want to kind of put some key questions out for folks that I think are really important as you kind of look at the context of kind of what comes next. Now that we're kind of 6 to 9 months after the decertification, really trying to adapt and really kind of move forward with this. Here's some kind of key questions I think I want to leave the audience with as you're thinking about what comes now, what's kind of these service gaps. How do we make better use of the resources we already have in the state and really improve and kind of ensure active communication and knowledge exchange? I think there's already some processes in place. The Catalyst Center, obviously, being a great resource for probation departments and also other kind of ways really trying to enhance technical assistance. But really, how can you make sure that the communication really is active and there really is a knowledge that probation officers as well as agencies have with what's out there, what's available, and what's best for the kids they're trying to place? Because I think a situation arises sometimes where a placing agency really, they kind of know what they know about the agency that they're either accessing or have history with, but it's always kind of hard to know who has vacancies, what are some of the new programs being offered, who has the best, evidence-based programs, and how are they being offered. So I think it's really important to think about how do we really improve that communication and that knowledge exchange. And I'm happy to say I think that's already kind of happening in some ways, but how do we really enshrine that and make sure it's happening as a consistent kind of course of business to make sure those connections get made? Secondly, how can the state best help to continue to break down barriers? And I think part of what the state can do as a funding entity of a lot of these things is really make sure they have the right kind of licensing, the right kind of solutions in place, and really kind of making sure that there's the residential services are really designed to keep kids close to the home as possible. And a lot of that comes from, and that can really come from that technical assistance and that support to make sure those needs get met. Because if there aren't actually the possibilities to place kids close to home, it gets very difficult. So how do we make sure the state in its role can actually continue to kind of play a supportive role and a developmental role and a partnering role with counties and really keep kids closest to home as possible? And lastly, what do probation departments need to do to really properly support providers? I think that's a big part of this. This has to be a partnership. And how do we kind of make sure we keep developing this together and make sure that the communication makes sense between providers about youth, the case plans are really thought through and well designed, and the partnerships really exist to give youth the best chance of success. Because as the placing agency, there's a lot of responsibility in that. And I think it's really important to keep thinking about how we keep innovating and improving that, because there's always room to communicate more, differently, better. And also as new providers come online with new services, how do we make sure that communication still keeps adapting and keeps improving? So I'm going to stop there for some questions, and I see there's some in the chat. But really the idea here was to give you guys a little bit of information about the context from the last, about 5 or 10 years, kind of as juvenile justice has evolved, as well as some information about kind of what's happening now in terms of as the decertification happened, what are some of those needs, what are some of those service gaps, and then how are we kind of working to do that? So I'm going to stop there and stop my screen share, and maybe Stephanie, can you help me with the chats a little bit, or I can read them off?
Sure. And actually, Kevin, there were some questions, and let's see. One of the first questions was, we struggle with quality foster care probation placements in California. How are the placements in California improving? How are they addressing mental health needs of youth and behaviors that occur in many placements, traumatizing other youth who are placed? And that is a great question. And I know Kevin is just actually covering more of the data component, but it will lead into the discussions that Seneca, as well as the Catalyst Center, will be presenting shortly. So I just want to acknowledge that one. The other question came in that says, why is juvenile sex offenders not one of the categories? And Kevin, I believe that's the second to the last slide that you probably went over. I'm imagining that's where that question was coming from.
Yeah, I think that one is because it was extremely low for actually out-of-state placements. So some of these, because I think just numerically, I think it was under 1% of all the out-of-state placements for actually juvenile sex offenders. That might be more happening in-state. So I think that's also a difference between who's being placed in-state and what happens versus out-of-state. But it was fairly rare. And that's kind of, I think just the complexity of the slide was getting a little bit big, but it was fairly low. So it is out there, but it's, again, it wasn't a pretty low percentage of out-of-state placements.
And the next one that came in, it says, now that there are no longer out-of-state placements, we struggle with locating placements for youth, especially youth who are hard to place because they are more difficult behaviors. This is requiring longer stays in juvenile hall. Most placements state they are full and do not have open beds. Is there a plan for additional quality placements to open in California? And I think that will be something that the Catalyst Center and the California Alliance will be can cover at that time. So I just want to, once again, I'm acknowledging people's comments, just so you know. And then older youth are also a large new population we are dealing with. And another one that came in, mental health services is one of the biggest needs I have seen, and I have been told numerous times by STRTPs that my youth needs a higher level of care that they can provide, and that is at the STRTP level. And then another,
and I think that,
oh, go ahead.
I think specialty mental health needs, and then also just different levels of mental health needs. And I think that's kind of where we're trying to kind of see, what does that development need to be? What does that capacity have to be? But I think there's also these issues that are, system-wide versus the out-of-state placement youth. And I think when we kind of looked at what the specialized care that people were getting out of state, it almost seemed like there was ability to kind of move some of those services in state if we just built the right capacity for it. So I think that's the important part about out-of-state placements. It wasn't always just about a lack of capacity. Something that was really about, there's some specialized needs these youth have that really there's very few places in the country meeting those. But some of the other ones seem like they are things that as capacity gets built and these partnerships get created, there will be more opportunities to actually have that capacity in state. But it will always be a challenge with mental health needs, just given, I think that's overall a challenge of meeting mental health needs in the state, just given the number of clinicians, just because there is again, like a lack and a kind of a need for more clinicians to serve those needs.
All right, I think that is it. Some of this stuff was very similar to what you had just indicated, or it was asked. Are there any other questions before we move on to the next segment? All right, well, thank you so much, Kevin, for presenting on this. If there's some additional questions that come to mind, you know, after Kevin has presented, please feel free. There may be some time after everyone presents to raise those questions up. All right, we'll go ahead and pass it over to Leticia Galyean, and she will be presenting.
Hi, everyone, and Hope, can you start our slide deck? Wonderful. Good afternoon, and thank you for having me, everyone. I'm Leticia Galyean. I'm Seneca's Chief Operating Officer, and also actually now transitioning into the role of CEO. As folks might know, our founder and CEO, Ken, is actually taking a step back to focus on starting his next big adventure, which will surprise no one. He's going to remain involved with Seneca, but he's also starting a new advocacy organization. So I appreciate the opportunity to be here. I'll first share a bit about our work with the out-of-state youth and then describe a couple of solutions that we've had the privilege to inform on. And seeing the questions in the chat, that's exactly right. These are the questions we should be asking. And I think we have some solutions to offer, all very challenging problems that we're trying to address. And I think there are opportunities here. So what we're going to share are some ideas about what we believe to be needed reforms in California to establish enough high acuity service settings and to support every youth in care in the state. We all share the common goal of keeping kids in their communities and wherever possible with families, regardless what their needs are. So the question becomes, how do we do this effectively? Next slide. So before I jump into the out-of-state work, I'll share a little bit about Seneca for folks who aren't aware of our services. We were founded in 1985 with a simple but profound promise to unconditionally support youth and families to thrive regardless of the challenges and circumstances that they face. That's not just a nice thing we say or put on our website. We really try to represent that in everything that we do. When a youth and caregiver are facing seemingly insurmountable challenges, we work to address those drivers that are contributing to those challenges, looking not only from an individual needs-based assessment, but also a family and systems approach. When a youth has had a placement disruption, like we've seen with the out-of-state youth coming back, or leading to out-of-state placement, we're not just looking for what is their next placement and how are we going to get them there, but why are they at home or with family or a permanent caregiver? And then asking, how do we get them there faster and how do we do that successfully? So you'll see that reflected in the two solutions we'll talk about later. And you can literally tie each of these recommendations down to specific youth and families that we know. And not just that Seneca knows, that we all know. These are youth. You know, when you see Kevin's demographic information, it's kids we know. We can think about the kids that we've seen fall into not just one of those buckets, but multiple of those buckets. So during the past 35 years, Seneca has evolved into a comprehensive provider of community-based education, crisis intervention, and family-focused services that's always promoting permanency and stability for youth, and really driven by a family-centered service approach. Our continuum of programs now impact over 18,000 youth and families in 150 programs across California and Washington state. We do serve youth involved in juvenile probation, child welfare, education, immigration, and behavioral health systems. And in addition to having numerous wraparound and collaborative court contracts and services much like the expedited transition services, we also provide services to youth with pervasive and high acuity behavioral health needs across a range of intensive and crisis care settings. So I'll have to say, no doubt when the opportunity arose, and I do describe it as an opportunity to bring our kids back to California, we were excited to participate and support the efforts. Next slide. So when the decision was made to decertify all of the out-of-state placement, CDSS engaged, obviously, county leadership, the Alliance and Catalyst Center, other providers to help coordinate the efforts of the state's services in supporting the returning youth, and began working closely with all of those entities to begin developing the resources to support the youth in the planning and stabilization of their return. Several planning sessions occurred with providers, counties, the state, where we all discussed and proposed solutions for things like assessments. And y'all have, I'm sure, seen the out-of-state assessment now that was used for those youth. Transition planning, building additional capacity, increasing provider engagement, all things that were proposed and considered. And, we're happy to be one of the providers that made ourselves available and sort of said, yes, we want to help. Let us know where we can push in. So as the process began to crystallize, the structure of the expedited transition services began to take shape. So you'll hear more from the Catalyst Center about their incredible technical assistance in this effort, including how they wrangled the numerous providers, all with unique specialties and expertise, different localities, to address the needs of the youth with some of the most complex needs we've seen. So to help paint that picture, I'd like to share the story of a young person involved with Seneca's expedited transition services this year. Our work with her and her family really elucidates the lessons learned from the expedited transition services. And as a caveat, Serena's name and identifying details have all been changed to ensure confidentiality. This is certainly not a picture of her, nor is that her name or any of the details. So let me tell you a little bit about Serena. In the summer of 2019, so just 2 years ago, Serena came into care after being removed from her birth family as a teenager, and as a result of physical abuse and her mom's concern about her own ability to keep Serena safe, including concerns, and again, you're going to hear things that sound very similar to the types of demographic information that Kevin was describing, but there's concerns of CSEC risk and or current victimization. And she was immediately placed in a foster home where in less than 2 months, she was expelled from school and given a 14-day notice from that home. This began, unfortunately, a progression of subsequent placement disruptions. Serena struggled to connect with her peers, engaged in substance use, and then assaulted a staff member at an STRTP that resulted in an arrest and formal juvenile probation involvement. So she became a crossover youth. So in the 11 months between her initial removal from care from her parents' home to placement out of state, Serena experienced 4 placement changes, 6 weeks of a juvenile hall stay, and 3 months of being AWOL. And the list of concerns for Serena range from substance abuse, assault, CSEC involvement, and crossover involvement between child welfare and juvenile probation. So while Serena's our client, her needs and story are not unique. We have all seen this youth. We all care about this youth. We all want something better for this youth. So no doubt the adults in her life were worried. The moment she returned from AWOL in the summer of 2020, she was placed out of state. When Seneca came to know Serena, it was through the process of the TA calls facilitated by county leadership, DSS, and the Catalyst Center. And we, like many other providers, were alerted that we had a youth who needed our help. So we joined the process of beginning to plan for Serena. In fact, I personally was on one of the first TA calls for her and can distinctly remember the very real fears her workers had of her safety in her return to California. Now exhibiting significant CSEC risk, as well as other complex needs like physical aggression and substance use, her team struggled to see how we could safely bring her home. So the team began to gather a robust group of providers to help try and create the stability she needed. Now, it's not been an easy transition, and we're still deep in the efforts to help stabilize Serena, but there's some very clear takeaways already. And in hindsight, it's clear to me that we do have the capacity to serve our hard-to-place youth in the state, but we need to strengthen our systems to do it effectively. Next slide. So there are a few lessons that can be gleaned from Serena's experiences. First is the importance of collaboration. From the very beginning of the process, this has been an all-hands-on-deck strategy between Serena's county workers, Seneca, the placement staff, and leaders, recognizing that what she needs is a well-coordinated approach to treatment planning. And I have to say, we could not have asked for a more supportive and collaborative team, from the juvenile probation and child welfare individuals up to and including the very highest levels of county leadership. This included often daily communication and coordination between Seneca and the county leaders, weekly and every other week CFTs in which we were revisiting services, the effectiveness of those, the ways they needed to change. Everyone was willing to bring tough issues to the surface, including concerns or disagreements about the approach to Serena's needs and the kinds of care she was receiving. And finally, there was shared ownership in her success. This was not the time for a hot potato game where we were saying, well, this isn't my youth, or I don't have the funding for that, but instead for all of us to commit everything we could to helping support her stability. Second piece was the importance of integrated behavioral health services. Like all of our youth with high intensity needs, Serena needed a team of folks able to flexibly provide intensive behavioral health services and be able to draw down the funding for that. Also share later in the presentation, this kind of braided service approach and funding is critical to creating the kind of safety net services our youth need and that our provider community can then deliver. And finally, relationships matter. This is a no-brainer. When Seneca called Serena's mom to discuss Serena's upcoming placement change, her mom shared that since her removal, no one had really called her and she rarely knew where Serena was living. So keeping Serena safe had come at the cost of centering and strengthening this primary relationship. Mom was not routinely involved in Serena's care, and now Serena was caught. And now, at this point, Serena is calling and texting her mom regularly, and she's become an integral part of the team, really helping us make sure that we know where she's at when she isn't in placement, for example. And of course, provider relationships. As I shared before, the coordination would not have been possible without the close collaboration with the county workers, juvenile probation, child welfare, behavioral health, CDSS, the Catalyst Center, and Seneca. And while this might sound like it's a no-brainer, it really isn't the way that all or even many county systems operates at times. The more siloed the services and the coordination, the more likely we see system and service gaps for our kids. Next slide. So as we look ahead to secure the needed systems reform to meet the needs of kids like Serena more effectively, there are two efforts that I want to highlight that Seneca has been involved with. The first is a set of policy recommendations that's been produced by the Behavioral Health Committee of the Child Welfare Council, and the second is a legislative proposal in the form of AB 808 that is authored by Assemblymember Stone, otherwise called the Children's Crisis Continuum Pilot. Next slide. So the first thing is the universal array. So the Child Welfare Council, first is a group that is co-convened by the California Health and Human Services Agency and California Supreme Court, and charged with monitoring and reporting on the extent with which the counties and courts are responsive to the needs of children in their joint care. The membership is comprised of state departments, county departments, nonprofit service providers, advocates, parents, and former foster youth. So Seneca CEO Ken Barrett co-chairs the Behavioral Health Committee of the Statewide Council. The committee is charged with making recommendations to the California Health and Human Services Agency and state legislature related to meeting the behavioral health needs of kids and families. And in 2020, the committee produced a set of policy recommendations that were approved by the council. One recommendation set offered a proposed template. It became known as the universal array of behavioral health services and supports that the community believes should be available to every child involved in or at risk of imminent involvement in the child welfare system. Next slide. So this proposed array of services and supports spans the service continuum from prevention and early intervention to high acuity crisis stabilization in inpatient services. So this starts to get at what do we need to do in order to help keep kids stable in their homes, in their communities, and when they are removed or go into care, what are the kinds of supports that they need to continue to receive in order to help ensure we don't find ourselves in the same place where we don't have the placements, we don't have the stability that our kids need. So while numerous solutions are presented, there are a few to highlight the breadth and depth of these recommendations. So first is creating universal K-12 school-based multi-tiered systems of supports that allow schools to implement not only academic, but behavioral and social emotional supports as well. That also comes with sustainable funding and an organizational infrastructure to do that. One of the recommendations is increased support and sustainability for family resource centers. The impact of FRCs is well documented, but funding remains limited and tenuous. And a final example, implementation of regionally based crisis continuums structured to allow for seamless transitions across a variety of services, including crisis stabilization units, partial hospitalization programs, and crisis residential programs. These recommendations suggest that this continuum of services, while ideal in every region and locality, should also be available at the very least to a population base of 750,000 to 1 million people. So for example, a smaller rural community, the array of services might span multiple counties where resources and infrastructure can be shared. Notably, what we also want to make clear is that a piecemeal approach to implementation is also really not the intention. We understand that for youth and families to benefit from tiered diversion, there has to be robust prevention to help families avoid formal adjudication. So while we can use the universal array recommendations to represent a full spectrum of needs we see throughout our systems, we want to bring the focus directly back to the gaps that resulted to the placement of youth out of state, placement options and supports at the very highest levels of the continuum. Next slide. So we provided a visual representation that Hope, who helped actually put this together, described a little bit as something that looks like soup, but I'll walk through what it looks like. It's really a depiction of how we think about what are the kinds of universal prevention, interventions, supports, and high-end placement options we can create. So for example, mobile response teams, or FERS, should be available as a universal intervention. Wraparound and the expedited transition services should support youth moving between these placement settings and kind of act as that glue, or as an effective diversion from the need for out-of-home care in the highest acuity settings. And the highest acute and like the psychiatric health facility, we want those to be available. And our belief is that that really needs to exist, but should be a very small care setting in this continuum. Next slide. So enter AB 808. Again, authored by Assemblymember Mark Stone, built from the consensus among stakeholders and providers that there have not been enough service settings for youth with pervasive and complex behavioral health needs. And this problem persists today. So the system gap, well known for some time, could not have been more clearly illuminated with the out-of-state placements and the decertification when that happened in December. And indeed, Serena was a youth for whom folks asked, can she be better served by remaining out of state? And if we're asking that question, we know we still have a problem within our system. So Seneca is proud to be following the lead of Assemblymember Mark Stone to further the vision for the continuum of care reform. We're co-sponsoring 808 alongside with the County Welfare Directors Association and Chief Program Officers of California. The idea being that many of these services come with significant upfront investment for infrastructure, staffing, and support. So only then can we begin to get to long-term fiscal and interdepartmental sustainability. So 808 would create grant funding where grantee counties can build programs of small, integrated, intensive, and highly individualized treatment settings to support seamless treatment of youth with complex care needs and rapidly return them to home-based care settings. So when the question is, where are these settings? Where are these placements? One of the answers can be we need to build them still. In some places they exist, in many cases they don't. It comes with a huge cost. So how do we invest in that now? Next slide. So a specific continuum model is outlined in statute for grantees. Counties can operate these services in-house or contract with many of the providers to develop each continuum component. The model includes crisis stabilization units where youth can be assessed, stabilized, and supported in returning home, avoiding unnecessary hospitalization, and co-located psychiatric health facility services providing hospitalization in the rare circumstances when a youth require that level of support and stabilization. A series of step-down options, including crisis residential treatment as an intensive hospital alternative, and enhanced ISFC, or what we might call a professional parent model that sometimes is often referred to as an STRTP1 as well. Expedited transition and planning services and 24/7 community-based supports, offering upfront and back-end supports to a core team of staff who can support each youth with step-up and step-down transition services. And these intensive crisis programs will be coupled with community-based supports in a full range of tiered placement settings, including intensive services, foster care, and integrated behavioral health. The AB 808 policy bill continues to gain traction and recently moved from the Assembly floor with a unanimous vote, so it's headed to the Senate Policy Committee. Next slide. So I'd like to return us briefly to Serena to think a little bit about how her story might be different if an AB 808 continuum might have been available to her. At the point that Serena was removed from the care of her mother, she was already experiencing significant risk factors, but there wasn't a clear path to resource prior to removal. What if expedited transition services could be used to help stabilize her at home at the first hint of concerns and disruption? If not prior to removal, certainly in her transition to the first foster placement to support stabilization there. And in that placement, when she began to exhibit very dangerous behaviors towards herself and others, what if she had access to and could be assessed at a CSU with comprehensive step down and safety planning, while emergency transition services continue to provide intensive staffing and support in the home? And if she couldn't be stabilized in the home, perhaps a crisis residential home could have been identified to keep her safe and keep her local to her mom. And finally, as those most significant safety concerns arose, instead of getting arrested and being contained at juvenile hall, had she gone to a PUF or a psychiatric health facility, would her trajectory have looked different? In that scenario, the expedited transition team could follow Serena across treatment settings, could bring all cross-sector partners to the table, and center her youth and family voice. And she would have access to a seamless continuum of placement options that she otherwise didn't have access to. Next slide. So I've included this slide. It might be difficult to see because the font is small, but just as an additional helpful visual to see how this continuum, the crisis continuum in 808, can work together. So if a youth is being assessed by a mobile response team or at a CSU, from that assessment, they can very quickly transition to a psychiatric health facility, or they can transition to a crisis residential, or they can transition home with additional services. But you can start to see how the flow of services, the flow of the experience for the youth can occur. And these will be provided afterwards so folks can look closer at that if helpful. Next slide. And I'll pause there for any questions that folks might have. I don't see anything in the chat, Stephanie, but I might have missed something.
No, there are no questions at this time in the chat.
Great. Then should I pass to Chris Stoner-Mertz and Alex Volpe?
Great, thanks. I'm just gonna share our PowerPoint as well.
Oh, we did get a question, and maybe more will start trickling in. Before we move on, where is Seneca located?
Yeah, we have services throughout the Bay Area, sort of as far north as Sonoma and east, if you can call it, as Solano, then all the way down through the Bay Area into the Central Coast, so including San Benito, Monterey, San Luis Obispo, a few services in Santa Barbara. We have services then again in Ventura, Orange County, a little bit in Riverside, a little bit San Bernardino. So kind of we sort of follow the coast with a couple of counties missing in between. And then we have services in the state of Washington as well.
And we also have another question that came in that says, does Seneca have STRTPs?
We actually have, part of the vision of 808, of course, is informed by our experiences. We actually have what is licensed as an STRTP that we act often as a crisis residential facility in our Ventura program. So actually attached to our crisis stabilization unit, the CSU, we have an STRTP, but it's very small, has 2 beds, and that's intentional. It's a very short-term, very high-end intensive behavioral health model. We also run professional parent homes, or what we internally call enhanced ISFC homes. So that's where there's a resource family who's highly trained, who actually lives in a home that is owned by Seneca, but has the availability of 24/7 staffing. So staff are on the campus at all times and able to push into the homes. So that's not an STRTP in and of itself, but acts very similar to it. And often we're seeing kids with higher needs or who have been kicked out of STRTPs come into our enhanced ISFC model as well.
A follow-up question is, how many of those do you have? And I don't know if you indicated, it sounds like you might have not indicated. Do you know offhand the locations?
Of the enhanced homes? That's your question, Stephanie? Sure, I'll try and answer that. We have enhanced homes that are actually located in Sonoma County, but in a partnership with San Francisco. We have enhanced homes in Santa Clara. We're building them in Monterey, also in Santa Clara County. And we have a couple of different partnerships that are in the midst of being built out. So we anticipate having enhanced homes in San Luis Obispo County soon as well.
And we have another question that came in. Do you serve CSEC youth and fire starters?
Absolutely. We don't say no. So part of the element of both the STRTP and Ventura County, but also our enhanced ISFC homes, is that we train our families and support them in the ability to never say no, and in effect also never kick the kids out. There have of course been extreme circumstances or situations actually where the county has chosen for youth to move, but in theory we should be saying yes to, and we do largely say yes to every child who is presented to us. It also means that, you know, we're partnering with folks that have additional expertise. For example, you know, in our enhanced homes, we sometimes serve youth with developmental disabilities or on the autism spectrum, and some of their names are pretty high, and we want to make sure even if our parents or our staff don't have that particular expertise, there's the availability of someone else to come in and help provide consultation for us.
Thank you. And then it says, are there plans to increase services in the southern region?
Yeah, we would love to. Really, what we look for in setting up our enhanced homes is a partnership. So if there are counties or you know, departments that are interested in building partnerships with us, we absolutely want to be able to do that. I think, you know, that the only limitation really is that partnership and the families. And I can say that, you know, recruiting for enhanced homes is one step more challenging even than recruiting for resource families, as you can imagine. But I'm also happy to provide all of this, you know, in writing. I can send you a summary really of what our service array looks like, including our enhanced homes, if that's helpful, because I understand there might be a lot of questions that come up about this.
Yeah, that would be great. And then there was just a comment and follow up from one of the questions. It says, with my questions above, specifically in San Diego, I feel we struggle with quality placements for youth with mental health concerns. There was also a question about, can you provide more information about STRP 41? And actually that's going to be, I believe, presented by Alex and Christine shortly. So we'll go ahead and hold off on that one. And then
I'm happy for Leticia to talk a little bit about that if you have provided that, or your homes mostly just the intensive foster care.
Sure, I'm happy to share. And to speak to the behavioral health piece, I think, you know, one of the things I would encourage counties to really look at and departments to pay attention to is...
Sorry, Leticia, it sounds like there's an echo on your end. There's an echo from somewhere.
I think it might be you, Stephanie. It's not on Leticia's end.
Yeah, I muted mine and it's not.
It might be Beth.
I think it's a participant, maybe Beth. I don't know if we can mute her.
And Beth, please mute. Beth Borovic. Can you mute? And thank you, Beth.
There we go. Sure, I'm happy to share a little bit about our enhanced model, and also to answer the question about behavioral health services. I would encourage departments and counties to really think about the degree to which that's an integrated part of the service array that you're providing. That there are a lot of behavioral health providers across California, and certainly, you know, rural areas, I would say, struggle with this more, and that makes sense because there's just fewer services in those regions. But it is so critical that those partnerships, when they get set up, when contracts get set up, that it is integrated so that the same provider, what you can have is seamless intervention that doesn't just look like what is wraparound, but what is wraparound plus behavioral health integrated? What is the foster care placement plus behavioral health provided by those same team of folks, so that then you don't have someone who's in some circumstances, there might be like in an outside therapist because a different agency has the contract to do the behavioral health services in a foster home, for example. And that's a place I would say, take a look at that. And to the degree to which your services are integrated, that might help to support the increase of behavioral health expertise within the system. And certainly there are providers who do and don't, have different levels of expertise or experience providing behavioral health care. So, that can also be a training opportunity. But I would make sure that that integration is there, so that, like I shared before, it's not siloed in ways that means that something is provided over here by this provider and something is provided over here by this provider instead. So to get to the question about the STRTP for one, I will name, a lot of people have been using that term to mean a lot of different things. So you might hear me describe what I understand it to be or how I think about it, and that could look slightly different from what someone else is talking about. But in the discussions about the youth returning from out of state, at many points, the question came to us, we have a youth with extraordinary needs. Could you create an individual plan and placement and support for that particular youth? And maybe that looks like it is a youth who is in one home with 5 staff at all times helping to support them. Or maybe that means that that's actually a situation like we have, where there's a parent who's highly trained that also has staffing available to them. So it could look like many different things, but in our model, it's something like a neighborhood. It's literally a cul-de-sac of 6 homes. We have, at any given time, 5 families with right now up to 4 placements, so that there's one family who acts as respite at all times. A family can leave, another family can come in and have respite. The youth stays in the home. The youth doesn't leave for the respite. So it's really based on this idea that as a neighborhood, as a collective group of families and staff, we can serve some of the highest needs kids because they're all helping to support each other. And it's really individualized. And as you can imagine, for that reason, also is a more expensive, more costly, more resourced sort of program than a typical STRTP. So that's sort of a flavor of what an STRTP for one or an enhanced ISFC home can look like. But the bottom line is, it's really about creating a treatment approach, a placement that is specific to the needs of that particular youth, and making sure that the resources are there in order to support them.
Thanks, Leticia. There was a couple more questions. I think it's actually relating to AB 808. Just to go back on that, it says AB 808 seems to be a pilot program for large population areas. What do you recommend for the small rural counties with limited resources?
I actually would recommend you bid for it, because that is part of what AB 808 is creating, is that funding, that pilot opportunity for localities and regions where this sort of system doesn't exist yet. I also understand what that means is you're, trying to figure out then what is the long-term plan and how to ensure that there's sustainability in providing those services. But I think looking at it from a regionalized approach, so maybe partnership with other neighboring counties, and also using the pilot funding available to create the infrastructure that might be needed. For example, if we're talking about a PUF or a CSU, there's like 3-hour firewalls that need to be part of that. And if that doesn't already exist, how are you going to create the facility necessary to meet those regulations, for example? I don't know if Chris or Alex would share more about that.
No, I think that addresses it for sure. And I do think as the idea behind the effort really is to try to address some of those regional needs, right? And there might be different variations of how to do that. I also noticed a question in the chat, Leticia, about whether 808 was creating new STRTPs comparable to the current ones. And as I understand it, it really is a different model in terms of what you're looking at.
Yeah, and I'll also give this caveat, which is that Assemblymember Stone is very involved with the legislation that he authors and forwards. So, there's I don't want to overstate what might be his vision, but that's right. I think one of the things that is the opportunity, though, is this idea of a crisis residential and the ability to continue to develop, additional capacity beyond the existing STRTP. So even an STRTP that exists right now, and there's, in no way are we not trying to also, make sure that the entire continuum as it stands right now is supported, but those folks, those programs can also actually then become a crisis residential or, increase the capacity support infrastructure in order to better or create a higher acuity of support for youth who might be placed with them and then fall under a different designation that could be part of additional funding for this. I don't know, Hope, if you would add anything else to that. Hope Kamer with Seneca has been very involved with supporting this effort as well.
Hi, all. Not to be a disembodied voice, I would just echo, I think, exactly what Leticia and Chris just shared. And I believe Assemblymember Stone is interested in furnishing this array that is for very high acuity youth, some of whom cannot be served in a traditional STRTP model.
Thank you. And so what we'll do is we will go ahead and move forward with the next part of the presentation, and then we'll open up for more questions afterwards.
Thanks.
Go ahead and take it away.
Thank you, Stephanie. Really appreciate it. We're so happy to be here today. Thanks for the invitation. We've just been thrilled about our partnership with CPOC, Rosie and Stephanie and team. I'm Chris Stoner-Mertz. I'm the CEO of the California Alliance and our Catalyst Center. I want to start by inviting anyone, particularly those I'm watching on camera having to sit, just stand up and stretch, please. This is a long presentation, so I hope you're taking care of yourself out there. The California Alliance is a 20-year-old organization that serves over 150 nonprofit organizations that are providing services for children, youth, and their families throughout California. We have a wide array of members who do services from wraparound, family resource center, very early prevention services, all the way up to the work that Seneca and others are doing, community treatment facilities, STRTPs, a full array of behavioral health, education, prevention services, foster family agencies, and working with youth and child welfare, juvenile justice, special education. So very wide range of organizations that we are serving, providing advocacy and policy supports. Our Catalyst Center, which you'll learn more about from Alex in detail, is a 501c3 that is essentially part of the organization, but which we've really stood up in the past year and a half to provide training and technical assistance to the field. One of our first big projects that was created in some ways because of COVID is our provider helpline. And that is, Alex will tell you more details on that. I won't get into the details, but know that this resource is available not just for providers, but really we want to provide what's needed across the field of children, youth, and family services. We love to hear from folks if they think there are trainings needed and other kinds of technical assistance that we can provide. Next slide. Thanks, Alex. So yes, we are going to be talking about, we're basically going to zoom out here from a lot of what Leticia talked about, looking at what what was really provided on an individual youth basis and family basis to sort of what are some of the system issues. And many of you are already asking these questions in the chat, right? I'll probably be able to move pretty quickly through this, but hopefully be able to answer some of the larger systems questions that are coming up. So yes, in mid-December of 2020, everyone got this call to action that 45 youth, or that there were 45 days, as Dr. Gonzalez said, to move 133 youth from out-of-state placements. We got a call from social services saying, how might the Helpline, the Catalyst Center, assist us in developing a plan with counties, with probation departments, child welfare departments that can help us move these youth in state as quickly as possible. And of course, many folks just needed to jump on it and make it happen quickly. We ended up working with about 60 of the 133 youth, so about half. Others, you know, as you well know, probation departments, child welfare departments may have made some of their own decisions about and not used these expedited transition services. But we really started to think about what would it take, what would need to happen, what would be the best model for implementing these expedited transition services, and what providers might be both interested but also really capable of moving quickly. So we pulled together primarily our wraparound providers that are Alliance members. We had 5 providers who were probably the most involved in this process. All of them were experienced wraparound providers, and they began to work. We also had regular meetings with the counties and the state. So the state let folks know we were pulling together organizations and beginning to look at how we could best assist in providing these expedited services. As you know, per Leticia's example, those expedited services organizations worked very closely with the county placing workers and the behavioral health departments, and started to just ask the questions of what does this youth need, right? If we're essentially starting from scratch, how do we build and address the needs of these youth on a very, very individualized basis? We were really trying to take that individualized approach that each youth might need different things. We were also involved with the weekly meetings. I know some of you were on those calls with the state departments to look at what are the gaps, what are the barriers, what does the system need to, how does the system need to adjust? There were also similarly on individual youth weekly TA calls, so that if there were gaps and barriers, we had office hours available so that those expedited transition service planning organizations could call in, and the state departments would each have a representative. So we could really knock down some of the barriers that often get in the way of really getting all those services to children and youth. The individualized assessments I talked about, a lot of engagement with family members. And I think the example that Leticia gave of, you know, in this one young woman's case, the family had really gotten, they'd sort of gotten pulled apart in the process of placement. So trying to get some of those connections reestablished was an important component. Those folks doing the expedited transition services developed individualized plans. They may have looked a lot like what already existed, but oftentimes they didn't. When you're a new face coming in, asking some of those questions that perhaps, you know, wouldn't necessarily have gotten asked by someone that had worked for a long time with that young person, it was an opportunity to maybe see things a little bit differently. The Catalyst Center really served to help identify potential placements. I'll let Alex go much deeper into detail about that process. But a component of this was creating a vacancy report, which she'll talk more about as well. And then we created a way, because of the rapidity that this needed to happen, we created a way in which ordinarily departments, behavioral health departments, placing agencies would have to contract for some of these services. For some counties, that was going to be a barrier. So we created a process where the invoicing could actually happen through the Catalyst Center as well. So that it really, there weren't some of the usual barriers that often exist as you're looking to place a child and get the kinds of services that are needed. Thanks, Alex. You can go to the next slide. So some of these gaps, you well know, existed. They, in some ways, a very bright light was shown on these systems gaps through this process, particularly because it did need to happen so fast. But of course, one of the issues was just the general communication about this review process that I think many folks were very surprised that this came up so quickly, even though it had been going on for some time. So that communication between state and counties was certainly a gap, and I think probably comes up at different points in time as something we all need to be paying attention to. The use of the individualized approach to really identify what a young person's placement needs are, you know, I think partly just because of the way our system is structured, it often sort of becomes a paint by number approach, right? Like, and I did see folks in the chat saying, you know, STRTPs aren't able to serve the behavioral health needs of all of our youth. So is there a systemic issue there that we could be addressing if we really paid attention individually to youth's needs and then built programs that ensured that the behavioral health funding was enough? So I think this opportunity was to say, let's look at these 60 youth on that very individualized basis. Let's actually build it and then figure out how we get the funding to support it. And given that there was additional funding made available, I think that assisted in people being able to think a little bit more creatively. The lack of information statewide is stunning. And we really learned this, and it's part of why we put this vacancy report together. And, you know, many placing departments have a list of 10 or 15 organizations they know, and that's who they call upon, which makes sense. It's what you know. But having a statewide database that providers can put information about their vacancies into can make a critical difference. And we definitely found, and you know, we're frankly surprised at times about services that were available that we didn't even know about. Obviously, another big piece of this comes down to the need for local interagency work. And I'm sure many of you are involved on a local level with AB 2083 efforts that are happening between the multiple different agencies, and more of that work needs to continue, I think, because then it does become a real team at that IPC process where you're trying to figure out what are the services needed, how do we really address it, how do we figure out the funding, which is all siloed. But the more that work happens, the more effective we can all be in providing those services to youth. Of course, there's regulatory issues, things like the need for some youth to have that something like secure perimeters around placements or delayed egress. And so I think one of the things that 808 is trying to address is that need. There have been some limitations based on the way that the California statutes and licensing works. Then, one of the even more recent issues that I'm sure many of you are hearing about is with the rollout of FFPSA, that's Family First Prevention Services Act, for those of you who don't know that acronym. We have now also run into an issue of are STRTPs going to be considered institutions of mental disease based on their size and configuration and the youth they serve. We are deep into this potential problem right now with many of our members and in conversation with the state departments about how we get at this issue. We've been, and I think CPOC is a sign-on to a letter that was sent to Congress. We've also created a coalition around this to try to get a congressional exception for what are now called QRTPs on the national level, but are essentially our STRTPs, because they will be limited to 16 or fewer youth if in fact they look like and could be identified as institutions for mental disease or IMDs. So we're working very hard on that issue. I'm sure that many of you will be hearing about that locally and also from the state, because the state DHCS has indicated to the Center for Medicaid that they will be determining what facilities meet the IMD criteria as of the end of December. And what that means essentially is that any Medi-Cal or Medicaid services that are paid for the youth in those programs would no longer be funded. So this is sort of an existential crisis for our larger providers. And we're working hard to remedy it in every way we can. So have really appreciated the partnership with CPAC on this and the advocacy. Some of the other things that aren't necessarily system gaps, but are trying to actually, frankly, address some of those gaps are in the budget proposals. You heard about 808. But there is also funding for youth with complex needs that has been proposed that could begin to address some of the things that folks are writing in the chat and some of the issues that you see that kids are bringing to placements. We, STRTPs have struggled mightily to make the shift from group home to the short-term residential therapeutic programs. We've found that the acuity of youth, and Kevin mentioned this earlier on, is higher because in fact, everyone has done a good job of reducing the number of youth in higher end care, but it does mean that the number of youth you have in a program, all of those youth are on that scale are much higher acuity and have much greater needs. That was not really thought through when the development of STRTPs was put in place. One way to address that, and many of you might have heard about AB 2944 getting passed last year. This bill allows for rate flexibilities. It's actually one of the vehicles that allows Seneca and others to create these very individualized programs so that you are not limited to just the traditional STRTP rate or the ISFC foster family rate, but you can create an individualized program for a youth, and that rate can then be used to get federal financial participation to match it. So that's one of the areas that the state has tried to begin to address some of the financing issues. We have to be using a statewide approach. I talked about that as it related to the vacancy report, but in lots of different ways. One of the things that we found through this process was that having State Department staff on a call available once a week to really address barriers that counties were finding they were hitting up against really made a difference in being able to be creative and thoughtful about these placements. There's got to be more around the TA process that we can build on. Again, ensuring that counties, the state, providers are all working together to address the gaps. We want to make sure that we include those family members and do a better job of family finding and identifying relatives that could support a young person, because, you know, our goal is to have fewer and fewer in longer term congregate care. And it goes without saying collaboration is essential. The other thing, and I know we're going to move next to Alex, that I wanted to just at least kind of make sure folks know about, if you haven't heard about it, there is an enormous emphasis in this budget cycle on children and youth's behavioral health needs and addressing those. There is, in fact, a $4 billion children and youth behavioral health initiative that Secretary Galyean has announced. And I think it's an opportunity to really think about ways to ensure we're getting the behavioral health services to the probation youth that are needed. I know that often is a gap, and I could see that in what folks were putting in the chat. So utilizing some of these, and there is a lot of funding out there. It's a question of how do we link what's in these trailer bills once everything is actually signed on the dotted line, but really ensuring that those funds are utilized to get these youth the support they need. Alex, all yours.
Okay, thanks, Chris. I appreciate it. So this first slide is a bit of a plug for the Catalyst for the Helpline. I'm Alex Volpe. I'm the program manager at the Catalyst, overseeing the Catalyst Helpline, and wanted to make sure you all were aware of this resource. As Chris mentioned earlier, we did start off a little over a year ago, largely in response to the volume of COVID-related inquiries that CDSS was receiving. And so the Catalyst has several program analysts. We answer the lines and the email. All the contact information is on this slide during business hours. And so we provide both like access to resources. We are compiling, continuing to add to, but have a pretty good database of resources statewide, whether those are like substance use disorder treatment facilities, providers that work with youth with eating disorders, access to protective equipment and those kinds of things, how to interpret regulations that come out. And we also get many requests for vacancy reports, which I'll be talking about just next, but you'll all be getting a copy of the PowerPoint, which has all of the contact information in here. So the vacancy report, we are really excited about. We began collecting this vacancy data in response to the out-of-state youth that were coming back and the need to find placements within a really short period of time. And we had always envisioned doing this project, but we're able to then partner with CDSS to implement it. And so we send out weekly emails to providers, STRTPs, FFAs, and THPs every week. And then providers submit vacancy data, and that updates our database to show where they have vacancies. And so they show vacancies by demographics. And I'm going to show an example of the kind of report that we can run on the next slide. But we have data from 45 counties, 78% of California, and the vacancy report identifies whether or not there are vacancies for probation or child welfare youth. As we started this for helping to find placements for the out-of-state youth, we are continuing to run the vacancy report and getting lots of requests to help find placements for youth that are in-state. As well. There are some limitations on the vacancy report. It requires providers to submit their vacancy information and to do it in a timely way. So there are, several providers that don't participate. And so we don't have up-to-date vacancy information unless the providers choose to participate. And in addition to that, they need to update it weekly. So we could run a vacancy report potentially showing provider X has 2 spots in their STRTP, but it's possible those spots got filled last month and they haven't submitted any updates since then. But it is generally a really helpful way to target some providers that will have vacancies for specific youth. And it's always surprising to folks when I share this data because I know it seems like very challenging to find placements for some youth, but we generally are showing on average approximately upwards of 1,500 vacancies at any given time. And you can see the graph on the right shows where those vacancies are, but there's significant numbers in THP, STRTP, and FFA. So this next slide, I know the font is a little small. This is an example of the kind of vacancy report that the Catalyst Center analysts can run. So this is just a sample one that we ran for a male identified 15-year-old youth from San Bernardino County looking for an STRTP placement. So we're able to run filters, right? So that we're just showing the STRTP placements that actually have openings for a youth with those demographic characteristics. And so you can see it lists by facility on the left, those facilities that have vacancies. And I know the font is really small, but right here you can see we're showing 41 STRTP vacancies for a 15-year-old male identified youth in San Bernardino County. I always like to pause and make sure to make the point that just because there is a vacancy doesn't mean that there's necessarily a match. So there may be 41 openings for 15-year-old male identified youth, but the facilities themselves, the providers, are always going to want to, find out more information about the youth and any sort of behavioral concerns. And of course, they have to think about what other youth they have in their facility currently. But it definitely is a great starting point as opposed to, just sort of randomly faxing out packets without knowing if there's even an opening at a facility. And what we've also found is that a lot of times placing officials they don't know of all of the providers because there is no centralized database for all of this stuff until sort of we're trying to get this off the ground now. And so sometimes they'll say, oh, I've never even, heard of that provider in this county. Let me, reach out to them and get to know them a little bit more. So yeah, this is the example of the kind of vacancy report that we can run. I did see in the chat earlier, I'm not monitoring it now while I'm talking, but someone had asked if the vacancy report is available. It's the database is managed by the Catalyst, but the contact information that I gave on the slide earlier, you can email or call, and we'd happily run reports for you. And it's easier for us to do that because then we can use the demographic information to show filters, as opposed to just showing you the 1,500 vacancies that are statewide. But that's the analysts are there to do that, and they're happy to do that for anyone that calls in. And so in addition to maintaining the vacancy report, we're currently contracted with CDSS to provide technical assistance and other supports for complex care youth in California. So some of our current activities related to this are on the slide. We provide technical assistance to county placement officials via sometimes referrals from CDSS and sometimes just direct county outreach. Some folks that have worked with us in the past will just contact us directly, so they don't need to be filtered through a CDSS TA call. But we do get many that are filtered through, that arise because of getting a referral from the CDSS TA call. And then we will outreach, we'll both look at our vacancy list, but we also have and are continuing to expand on provider profiles. So going back to the matching thing that I was talking about earlier, right? You might have an STRTP that's showing a vacancy, maybe there are 10, right? But then we can also go to our provider profiles and say, oh, this is a youth that has a history of fire setting, and we do know one of the providers does have a clinician that, has a curriculum to work with fire setting behaviors. And so we can try to do some of that matching. We are still very much, that's a work in progress. So we're still really ramping up our provider database, but we're trying to really be able to broker those matches and make introductions and try to help with the matching for some of the complex care youth. We facilitated a couple of meet and greets between probation officials, and first was providers that work specifically with probation youth. And the second one was with providers that specifically serve commercially sexually exploited and pregnant and parenting youth. So we're going to be continuing to hold those and just in general try to form better collaborations and better awareness of where the services are, so that you spend less time in the hall or in the hospital or in a county worker's desk, but actually can end up landing in the placements with the services that they need. So as we get referred youth, as I said, sometimes through CDSS TA calls, sometimes direct outreach from counties, but we are started to track the youth that we get referred for technical assistance to try to understand what kinds of things we want to be thinking about as we're trying to support our provider community in developing some of these individualized models that Chris was talking about before in terms of spending AB 2944 funding on them. And so these are just tracking a number of different demographics, but I just wanted to show a few. These include probation and child welfare youth. And so we'll see, although I think it's also interesting how some of these demographics differ a bit between the data that that Kevin shared earlier. For instance, with the complex care youth that we're seeing referred to us tend to be disproportionately male, as opposed to the female youth, the larger percentage of female youth that were sent out of state. To no surprise to anyone, we're seeing a lot of older youth that are getting referred for as being complex care youth that have maybe been into 21 different placements or something like that. Seeing lots of high numbers for youth that are at risk of self-harm and risk of harm to others. And there's also often overlap between those categories as well. And things that have been pointed out before, right? Youth that are commercially sexually exploited and or have substance use disorders. We're also seeing a disproportionate number of youth getting referred for technical assistance that are transgender or non-binary. And just to give a sort of idea of the numbers of these youth, so the Catalyst has been involved in these complex care TA requests only since the beginning of February. And we have already received 85 TA requests for complex care youth. So this is a huge need for our system to address the gaps that we've all been talking about today. And I'm gonna now turn it over to Chris. Maybe we'll just take questions at the end. And Chris is gonna talk about the Alliance's recommendations to
I did put in the chat a link to a document that our membership put together related to STRTPs and as I mentioned earlier, some of these high acuity needs, and it's also here in the there's a link in the PowerPoint as well. So for folks to take after the presentation. One of the issues is that because you're working with multiple different counties, behavioral health departments vary in how they develop contracts. Leticia talked a little bit about this in developing individualized programming as well, but we have found that there is a very wide range of what kind of contractual agreements get made for STRTPs in terms of getting those behavioral health needs met. Could you go back one slide, Alex? Thank you. And so we're really looking to sort of address that although mental health services always need to be very individualized, we need to see that there's some minimum, at least contractually available for youth who are going into an STRTP. We know they have mental health needs. We really also are trying to look at what the educational requirements are for staff. There has been a sort of a increasing requirement around bachelor's degrees, et cetera, and it has limited the pool of folks that are available to work in an STRTP. As many of you well know, these are often folks from who are making, as much as they'd make at Starbucks with a whole lot more stress. And so being able to have a pool of folks that can be trained to work in STRTPs without simply putting an educational requirement and thinking that is going to address, the quality, we think is a little short-sighted. We'd like to see that be broader. There are a lot of training requirements for staff in STRTPs, not to mention the background checks, et cetera. So having some more flexibility around that we think is important. And how the STRTP rate is structured is really problematic in terms of the required, it's based on a certain percentage of youth being in a program. So we'd like to see some changes there. The other things that we're looking at, and Leticia, again, address the crisis continuum of services, but there is another bill that we're involved and sponsoring called, that is AB 2226, which will create what is called a psychiatric residential treatment facility. that would provide crisis residential care in California. So that is moving through the process. We're excited about it. And DHCS thus far seems to be supportive. This would create a Medi-Cal-based program. So all of the funding for this placement would be Medi-Cal, rather than some of it being through Title IV-E as the way that the STRTPs are structured. It is built to be a slightly higher level of care in terms of what's required. But of course, lots of details yet. It's still in process. We hope that it passes through the legislature. We already talked about the need to really look at, some flexibilities around delayed egress. And I saw someone in the chat also mention something about WIC code related to that. Let me go back to that for just a second. Around locked regional mental health and probation programs were contemplated. And then the question really is, will 808 truly offer another level of STRTPs that can have staff trained and able to serve youth with extreme behaviors? It seems that would require the locked unit capability, but that is voluntary for 14 years of age and older. Are you referring to the WIC code, James? I don't know if you want to answer that in the chat or if you're still on the line, but maybe not. Yes, the CTF, the Starview CTF is a locked facility, but the structure of the CTF, the community treatment facilities, and there are 2 in California, they're voluntary. So in order for a youth to be in that level of placement, that type of placement, they do have to agree. That is not the case with a psychiatric health facility. Am I right, Leticia? I think I am.
Yeah, that's right. I would also add to that answer, if that's okay, Chris, to jump in, that I think, the PRTF designation or PUF pilot or the ability to add PUFs to the service array isn't intended to be the only solution. What we're really looking for is to build out those ISFC homes, enhanced homes, and other opportunities as well, so that what we don't find is that kids who don't need the very highest levels of care aren't sitting in a bed that a youth who does have those high needs is taking up, so that we expand what the opportunities are across the entire continuum, then allowing for there to be more flexibility, more availability in those very high levels of care in STRTPs as well. That I think what we have certainly seen with some of our county partners or some of the kids, that we've worked with out-of-state youth, is that because there haven't been enough ISFC homes or resource family homes, there's kids that are in STRTPs that maybe could step down, but there isn't availability for that, which means then there's fewer STRTP beds. So it's intended to really expand the entire continuum of placement opportunities, so that placements are happening for kids more appropriately based on what their needs are.
Thank you, Leticia. I don't know if we have other questions in the chat or.
Yes, we.
Okay.
Oh, go ahead. Sorry,
No.
Chris. Did you want to go through this last slide and then we can open up for questions?
Yes,
we have
thanks.
about 15 minutes left.
I think we've really covered a lot of these, so maybe really briefly. I just talked about AB 226. Ramos is the author that creates this new model psychiatric residential treatment program. It is focused again on crisis residential, but it will be a new license category in California if it gets passed. And then 808, Leticia has talked about We also have engaged Assemblymember Stone through his cleanup bill, AB 2083 for CCR. He does this every year to sort of address ongoing gaps and issues with CCR. We have brought some language to him around the STRTPs and some of these gaps that you would read about in the document in more detail to begin to try to address some of those issues. There is, and I did talk about this earlier, the 42 million that is available was actually in the May revise, and the legislature is also supporting this for complex care needs of youth. The legislature added $100 million to their budget as well. It hasn't directly been linked to the crisis continuum of care. We haven't seen the language that actually officially does that, but it does happen to be the same number of dollars. So any questions in the chat there, Stephanie?
Yes. So just going back in reference to the vacancy report, it says if there are licensing or care concerns regarding a program, will that program still show on the vacancy report? Any cross-referencing with CCL?
It's a great question. We actually haven't that I'm aware of. Alex, have we done any cross-referencing?
The only cross-referencing, we have not done that kind of specific cross-referencing. The one piece that we've started now tracking and looking at are especially if we're doing a vacancy report for a youth that is more complex needs, we will cross-reference to see if they are potentially provisionally licensed as an STRTP, and then thus may not have all of the wide array of mental health services in place. So that's one thing that we have been cross-referencing, but in terms of, no, we're not doing that right now. It's an interesting suggestion.
And the other question that came in, and I probably will be able to help answer this question, it says CDSS used to have a chart spreadsheet of all the STRTPs in California with the name, county, headquarters, and that were STRTP certified. I noticed that the list is no longer on the website. How else can we find out what STRTPs are in California when having to look at what is available, or is the vacancy report essentially a tool that would have that information? And in reference to the external tracker, I think they call that the external STRTP tracker. I do notice that it used to be on the website, and I believe there might be some HIPAA issues, some other concerns, the reason why it was taken down. So the associations actually would normally get them on a monthly basis, and I believe it has kind of slowed down of us getting it, and it is disseminated to the CCR point of contacts. It does not cover vacancy, but it does have a list of the facilities. And also just the status of where they're at. I know there has been a reorg in reference over in the department, which it used to be the CCR branch, and now it's called the System of Care branch. So I think they're just going through some changes. Hopefully we can get ongoing Excel sheets with that information. But you do have a good point in reference to vacancy. It would be nice to have both of those captured at the same time.
Yeah,
so
we more is indicating that yes, that was due to accessibility issues, ADA requirements. I think that it came off the website, but we do get those, and certainly call the Catalyst.
Yeah, it's very easy for the analysts to run reports, not just on vacancy information. And again, as I mentioned earlier, that vacancy information may not be comprehensive. We might be missing some vacancies, right. Some information could be outdated. But what the analyst can also do is run reports for any THP that works with youth in X county, whether or not they have vacancies. So we have information about all of the providers. Now we're building up the accuracy. I would say, we started with the STRTPs. So I think we have a pretty accurate list of STRTPs and their capacities. as well as, you know, the THPs and FFAs, but we're building those, you know, more of the details that I talked about earlier in terms of specialized populations. We're building that piece out, but you're welcome. Anyone is welcome to reach out to Catalyst for a list. It doesn't just need to be vacancies. It can also just be facilities.
And it looks as though there was a comment about the facility search. It says, I have used CARE's facility search, which is also a good place to look for STRTP and licensing issues can be seen. One thing I would also want to include is that DSS also has a CCL facilities transparency website. And I can actually put that into the chat if you want to look at it. But you can do a search in specific providers that it lists, like if there's any
issues.
I guess, like if there's any claims or, you know, it has information, more information, and you can actually subscribe so you get email notifications if there is something that has occurred, you know. And once again, you have to be, that shouldn't be the only thing for you to base your decision, you know, in reference, that's what we share from CPOC to decide if you want a youth to go with a certain provider. I think you would want to look at the big picture overall, because sometimes certain things are not substantiated. So just also factoring that as well. And let's see. I think that may be it at this moment. Are there any other questions, any feedback, anything that you want to share with our presenters today? All right, and then I wanted to also share real quick the transparency site. I'm trying to pull that up real quick.
It has been a real pleasure. Thank you for having us, Stephanie.
No, thank you. We truly appreciate it. And I was going to say that also the information that was shared in the link by Chris, it will go out to, it will be posted after the conference. And before we close, I just want to make sure that Chief Gonzalez, are you
here for ready to close?
Oh, there you are. Okay, great. I want to go ahead and pass it over to Chief Gonzalez because he's going to be doing closing remarks. Thank you, Chief. Take it away.
Thank you, Stephanie. Well, first of all, on behalf of the Chief Probation Officers of California and the entire staff over at CPOC, I want to thank our speakers for presenting today. We'll give you a round of applause. You did a great job. I'm sure you'll be getting a lot of calls. I also know that there's much work to be done still. So we're not done. So hopefully through this ongoing collaborative efforts, we will continue to enhance and provide more solutions to address the needs of our young people. I also want to thank all of our attendees for joining us. I know it's a long 2 hours, so thank you for hanging in there. We hope you found this information very valuable. Resources are here. Bills have been posted as well. So thank you for your participation. And as a friendly reminder, you will receive an email with a conference link so you can provide us your feedback. We welcome your feedback. It helps us make the conferences better, but also let us know your thoughts about next year's conference so we can be prepared for next year. Hopefully next year will be in person. Once again, I want to thank each and every one of you for coming to our conference, and this will conclude our 5th annual conference. So thank you so much, and hope to see you in person next year. Y'all have a safe drive home, stay safe, and we'll see you soon.
Thanks, everyone.
Bye-bye.
Thanks, everyone.